Hi, my name is Cindy Stein. I'm a licensed physical therapist and a certified Graston practitioner in Pittsburgh, Pennsylvania. Today I'm going to demonstrate Graston technique on plantar fasciitis. Graston technique is an instrument-assisted form of transverse friction massage that goes in and helps release scar tissue, breaks up adhesions, and essentially makes the muscles slide better. For this technique on the ankle, I'm going to use these different instruments, which are all designed to meet the needs of the tissue. The first thing that you do is you put an emollient onto the site and rub it in. That allows your instruments to slide while you're doing this treatment. With plantar fasciitis, I would address the gastrocnemius as well as where the plantar fascia comes in and attaches into the calcaneus. I'm going to take this instrument and scrape the gastroc and feel whether there's any grit in it. And it actually doesn't feel too bad, except for maybe right there. How's that feel, Bridget?
Good. I can feel that one spot.
Right here.
Yep.
So I'm going to concentrate a little bit on that. Come down and get the tendon. I can use my instrument here and come up and slide against the tendon with this. As you see, it has a curve to it. Very nicely fits into that tendon. And it's not showing much in the way of hyperemia or redness, which tells me it's not too bad. I'm now going to go down to the foot, and I'm going to scrape, and you can see she is flinching.
It's tickly.
Okay, she's ticklish. And I'm going to go in both directions. And I'm feeling a little bit of grit right in the medial side of the calcaneus. So I'm going to take this instrument and I'm going to come up and I'm going to cup around and scrape around that insertion where that tendon comes into the bottom of the calcaneus. How's that feel?
Good.
I can also use this to come up along the side of her feet, get both sides of that fascia. And then the last instrument I use is my instrument that looks like a butter knife. And I'm going to come in and I'm going to go a little more specific to where that comes into the bone. This feels good in a perverse way. It's painful, but the pain that you feel makes you realize that it's actually doing something. Now, you can also do Graston with movement, active movement, and that again puts the muscle in a different, the fascia and the muscle in a different contraction so that you can get any scar tissue that is actually affecting the way that is being used. So slide down a little bit. So I'm going to have her flex and extend her foot. And while I come up, and I feel a lot right there as she's contracting it up into dorsiflexion. How's that feel?
It feels good, actually.
Good. And I'm going to take my butter knife again and have her continue to do it, coming both upwards and downwards. Oh, there's a lot right there.
Yeah.
Against that insertion. Graston technique is a very, very effective technique for this disorder of plantar fasciitis. Thank you for your time.